Hello everyone, it's Nicholas Ellis here tonight. I am going to talk to you about Asperger's and the job search stuff, and we're going to go more into detail about that tonight. Um, just to let you know, I haven't uploaded a video for a couple weeks now, and um, I'm doing pretty good. I've been working the last couple days. Um, as you can see, I need a haircut. I know that. I'm doing pretty good. I'm just a bit tired, and been working a lot. I worked about 5 days in a row, which was fine. I mean, work's going well for me. I just wanted to go over some things about seasonal affective disorder tonight and depression and stuff. There's a disorder in the winter that can be called seasonal affective disorder. This doesn't necessarily have to do with Asperger's or autism, but it can affect people with Asperger's or autism. Um, doesn't mean it will, no. But seasonal affective disorder can affect a lot of things. Um, I'm not a doctor, but as you can tell, I'm going to pull up the internet here. Um, Hold on here. Okay. I'm going to pull up the internet here. And I'm going to search seasonal affective disorder. If I can actually spell it tonight. Affective. Can't spell tonight. Okay, now I found it. Just searching for it. And right here. Okay, hold on here. Okay. Seasonal affective disorder is a type of depression that's related to changes in the seasons. Also going to be changes in sunlight. Um, as for me, I don't have seasonal affective disorder. I would say I don't know too much about it. Like most people, the symptoms start in the fall and continue in the winter months, sapping your energy and making you feel moody. Less often, seasonal affective disorder causes depression in early spring and early summer. So, this can make Asperger's and um, uh, um, uh, anxiety worse too. Treatment for seasonal affective disorder, there's light therapy. That would be like probably like a sun lamp. We have one of those. Um, there are medications for it, obviously, but I'm not here to recommend medications. I do suffer from anxiety. Sometimes I do feel a little down and stuff, but I think it's more the, I don't know, I guess it could be more of a mood problem than anxiety, or it could be maybe from some of the foods I eat too. I happen to be allergic to corn syrup and I have a food intolerance to it, so I notice when I eat stuff with like corn syrup in it, I have higher, my anxiety gets higher and I get more moody. Symptoms of seasonal affective disorder. Um, in most cases, seasonal affective symptoms during late fall or early winter, go away during the sunny days of the spring and summer. Less commonly, people with the opposite pattern have symptoms that begin in spring or summer. In either case, symptoms may start out mild and may become more severe as the season progresses. Um, Signs of seasonal affective disorder: feeling depressed most of the day, nearly every day, lost interest in activities that you enjoyed, having low energy, having problems sleeping, experiencing changes in your appetite or weight, feeling sluggish or agitated, having difficulty concentrating, feeling hopeless, worthless, or guilty. Um, this will make you a bad person. It just goes with this disorder. Like some of these symptoms can go along with depression and stuff, and if you have depression, you should consult a doctor or a psychiatrist immediately. Um, I'm not really trained on depression, so that's a disclaimer. Um, I do not recommend medications or stuff or any kind of stuff for any. Let's put it this way: I'm not a doctor. Symptoms specific to winter onset seasonal affective disorder, sometimes called winter depression: oversleeping, appetite changes, especially craving high foods that are high in carbohydrates, weight gain, tiredness or low energy. Um, Symptoms specific spring and summer seasonal affective disorder. Symptoms specific to summer onset seasonal affective disorder, sometimes called summer depression, may include trouble sleeping, insomnia, poor appetite, weight loss, agitation or anxiety. Um, Anxiety can be caused from many other things too. It can be related to social anxiety disorder that can go along with Asperger's too. So don't confuse it with just seasonal affective disorder. Um, um, when to see a doctor? It's normal to have some days when you feel down, but if you feel down for a day and can't get more of the activities normally enjoy, see your doctor. This is specifically if your sleep patterns and appetite have changed, you turn to alcohol for comfort or relaxation. Yeah, alcohol is not really good for that. I don't know. Um, with like anxiety and depression, like let's go look at Asperger's and anxiety now. Um, I'm trying to be a little bit more organized tonight. Okay. Okay, hold on here. Here's some questions about are Asperger's and social anxiety the same? Well, often confuse Asperger's social anxiety are different. Hold on here. Asperger's disorder is also known as Asperger's syndrome is a pervasive developmental disorder that belongs to a class of autism spectrum disorders. It involves impairment in certain basic aspects of communications and relationships. Although both Asperger's and social anxiety experience in difficult social situations, they are different disorders. The diagnostic criteria of the symptoms are very different. Asperger's is usually diagnosed in childhood. If your child has been diagnosed with this disorder, he or she might have symptoms of engaging in restrictive repetitive behavior such as becoming excessively preoccupied with interests, routines, rituals, parts of objects, repetitive motor mannerisms such as hand twisting, like flicking of my ring, that's a symptom of it. That's actually stimming. Experience significant impairment in social interaction such as problems with eye contact, facial expressions, and body postures. Have trouble developing friendships, sharing interests, and understanding social and emotional perspectives of others. This is quite hold on here. Okay, we're looking at social anxiety disorder now. How do social anxiety and Asperger's differ? If you have social anxiety disorder, it is the driving force behind difficulties that you experience in social and performance situations. Your ability to function is very limited by your anxiety in those situations. A diagnosis of Asperger's, on the other hand, does not require the presence of anxiety, but behavior in social situations. Instead, impairs because of trouble reading and misunderstanding social and emotional cues. That could be verbal cues too, the pitch of the voice. People with Asperger's may appear tactless and rude, be unable to take hints or understand humor. I have a hard time understanding humor. Have trouble understanding the meaning of gestures, tone of voice, and facial expressions. I particularly have a problem with tone of voice and with facial expressions. I sometimes stand too close. And yes, I do talk real loudly, as some of you may realize. These characteristics are opposite of those displayed in social anxiety. If you have social anxiety disorder, your fear of embarrassment or humiliation most likely manifests in many ways, like being oversensitive to body language of others, speaking too softly, standing too far away. Those who have social anxiety are capable of forming relationships but are impaired with anxiety. On the other hand, people with Asperger's have a difficulty with nuts and bolts of communication that make relationships possible. Research function on the brain. Here's a study about that. Neural imaging may shed some light on the brains of people with seasonal affective disorder and Asperger's disorder. Studies of the brain function show most people with the amygdala, emotion center of the brain, is activated when understanding facial expressions. On the other hand, those with Asperger's prefrontal cortex, the center of judgment and planning, becomes active when processing facial images. This means people with Asperger's try to logically figure out the meaning of a facial expression. I have problems with that, rather than experiencing an automatic emotional reaction. Studies have also heightened sensitivity of amygdala, which is the emotional center of the brain, in those with social anxiety disorder. This makes it even more clear that the two disorders are very different. Although there is no form treatment for Asperger's and social anxiety disorders, although there is no firm data that comorbid anxiety disorders are common with children with Asperger's. This means it's possible for a child to have Asperger's and social anxiety disorder. Whether a child has one or both, social skills training is the one treatment that may offer a promise for both seasonal or social anxiety disorder and Asperger's. Although social impairments in Asperger's and social anxiety disorders may differ, many of the same symptoms are present in both disorders. If you have Asperger's or social anxiety, you likely have a host of social skills deficits, such as problems with posture, eye contact, speech qualities, such as tone, volume, and rate. In addition, you have trouble building and maintaining friendships, which I have problems with too. I know I'm an adult, I'm almost 35 and I have Asperger's, but I still have a difficult time finding friends and keeping friends, and yeah. Social skills training has been shown to be effective in treating social anxiety and may also be a promise for those with Asperger's in terms of developing basic skills for interacting socially. A word from Very Well. Whether your child is showing signs of Asperger's or anxiety, trouble, social situations, or struggling, it's important to contact the doctor to learn of your particular array of symptoms. When I was really young, there wasn't much awareness about Asperger's syndrome. There's more awareness of it now. There's more help for it now, and early interventions for Asperger's, autism spectrum disorder, compared to back in 1994. If you were probably born in like 1992 through 95, you may have had more early intervention that we did. I'm almost 35. I'm not sure what it's like in different countries. As you can see, if we look back in the past and compare it to today, I mean, I think overall I function pretty good, but I think there's still room for improvement. I still wish that there could have been early intervention when I was young, but unfortunately there was not any early intervention. Um, I am quite surprised I was even diagnosed at the age of 7 in first grade, so that was around December of 1994. So, and actually, the diagnosis back then was called. Hold on here. I think it was. Pervasive developmental disorder. That's what they called it back then. And now it's just all put together in one disorder. Here's the old diagnosis. That's what it was originally diagnosed with, then it changed to Asperger syndrome. So, people with pervasive developmental disorders include delays and typical delays, problems socializing, communicating, trouble when it comes to routine, repetitive movements. The term is not used by doctors anymore. PDDs are now usually called autism spectrum disorder. The name change came in 2013 when the American Psychiatric Association reclassified autistic disorder, Asperger syndrome, child disintegrative disorder, pervasive developmental disorder, not otherwise specified, as autism spectrum disorders. Why was there the change? The change was the spectrum concept is a more medically accurate way of diagnosing people with these disorders. I've had some doctors that don't agree with that, so they think Asperger should be in a different category. That's just personal opinion of the doctors. If you go to other countries, it still might be called Asperger syndrome. It's not. Symptoms autism spectrum have social difficulties, and they have repeat certain behaviors. They avoid eye contact, which we talked about earlier. Not able to express their thinking through language. Sometimes I have a problem with that. Have a high pitched or flat voice. Find it hard to keep conversation. Do I find it hard to keep conversation? No, not really. I tend to dominate the conversation, which isn't good either. So, it's either one or the other. Have trouble controlling emotions? I would say I don't, but it all depends on who you are. Repetitive behaviors such as flapping, rocking, jumping, or twirling. Causes of ASD is a big topic of research. Scientists know that genetics are one of the risk factors for autism, but they don't know the answers yet. There's not one autism gene or Asperger's gene. Many things in addition to genes may be involved. Diagnosis and treatment. To make a diagnosis, doctors observe the child and ask questions of the parents and guardians of the child's behaviors. There is no lab test for Asperger's syndrome or autism spectrum disorder. It's not like I can go in and get test for like COVID-19 and find out 3 days later that you got it, that you test positive for it. It's not like that. I'm just trying to use a figurative example. It can take longer than that to get a diagnosis of autism or Asperger's. It just doesn't take 2 days. Asperger's is not a disease. It's it's not a virus or a disease. So to those people out there that say it is, it's not. It's not acceptable to call it that. Um, People with Asperger's and autism spectrum don't like that. Um, so that's one of my biggest pet peeves is don't call it a disease because it's not a disease. Um, it's not. Yeah, like I said, it's not that easy to diagnose. There are medications to help symptoms, obviously, for Asperger's. Medications work best when paired with therapy that develops socialization and other life skills. A medication is not a cure-all for autism or Asperger's. Um, Keep in mind that those in the spectrum experience the world differently. Their victories and challenges may be different from yours. So my challenges might be different than somebody else's challenges. That's nothing new. That's normal. That's actually pretty much normal with everybody. Um, um, it helps appreciate victories and challenges might be different from yours. It helps to appreciate them as they are. Each individual with autism or Asperger's have their own unique personalities and interests. While you get them support and skills could make a big difference in their future. Some are good at rock climbing, some are good at computers, some are good at singing, maybe some are good at uh, kayaking, or maybe some can are good at survival skills like living out in the wilderness and going camping and stuff. Um, I mean, that's cool too. I mean, it's one of those things where you just kind of gotta, let's put it this way, it's every day is kind of a challenge for me. But keep a positive attitude and try to stay positive, and usually things go pretty good. Um, Not every day is perfect, and not every day will be perfect. Um, and to those out there that think it's easy to have Asperger's, I have my good days, I have my bad days. Yeah, I'm lying. I have my good days and I have my bad days. I certainly wish I had more friends. I certainly wish sometimes things were different. Um, it basically comes to down to the point where you gotta accept yourself. There are many support systems out there. There's support systems on Facebook. There's Facebook groups. There's if you belong to I know everybody with Asperger's don't belong to Facebook. If you belong to other social media platforms, there's other Asperger support groups too. It's all in all what you want. I know not everybody likes social media. I recommend social media for people to find other friends with Asperger's. It doesn't work for everybody. It's one of those things where, yeah. The question is, there's nothing wrong with having online friends. Um, I am going to sign off for the night. If you like my video, please subscribe and share it if you'd like to. Have a great night. This is Nicholas Ellis signing off. Thank you. Good night.